Much really interesting topic, talking about education, building capacity, and understanding the context are really important in such a sort of very crucial topic. We'll open the floor for discussion. Unfortunately, because we are behind time, so we will squeeze the number of questions and but we'll try to be inclusive. Any question? You're tired, right? Me too. Wafat?
Well, thank you very much for a really very interesting session. I have a question for Sibyl. It's really very nice to see that you're including this in the curricula for all the medical students. Is there any thought of potentially giving the medical students during their training in medical school the opportunity maybe to potentially get training experience maybe at the migrant health clinics, or like a practical experience as well, to get a sense of the real situation as it on the ground?
It's working, no? Yes. Yeah, exactly. As I mentioned, we also try to increase the number of educational settings for our medical students. So we take them to the field more often. In fact, we have been doing this for so many years, but only at the last year of medical education during this public health clerkship. Now we try to do this starting early stage of medical education, starting from the first year. So we take them to community health center. So if there are now new refugee health centers, of course we want to take them there. So, but of course there has to be a certain expectations once we take them there, because we want them to, to make it meaningful. So yes, I mean, we are doing, and there will be more.
Good afternoon. So I have a question for the group. I always like to ask whenever we talk about humanitarian relief and workforce, and I appreciate the Haiti example. I was at New York Presbyterian Cornell when the Haiti earthquake hit. Cornell runs a very large HIV clinic in Port-au-Prince, and there was one, and when the earthquake hit, as you can imagine, everybody from everywhere wanted to fly there immediately, parachute in and help. There was one professional that Cornell essentially airlifted in, because that professional was so urgently needed. So my question for the group is, who was that professional? What was that professional that was airlifted in? Everyone wanted to go, but who was immediately needed? Public health, that comes up. No. I always tell my students wrong answer is better than no answer. And I'll give you a hint, it was the non-health science campus. Psychiatry comes up, infectious disease comes up. Go ahead. So I can answer, yes. It was good, excellent. It was a structural engineer. So this clinic was hit with the earthquake. Hours later, everybody wanted to pour in there and help. But they had, at that time, they had doctors, they had nurses, they had stuff, they had people. They didn't know which buildings were going to cave in over their heads or not. And they needed a structural engineer to fly in and help. And I tell this story because you talk about global health, humanitarian relief, what have you. Everyone is very good at very specific things. And this is a reminder to us that most of us weren't qualified structural engineers, and that's what they needed. And a quick follow-up, there was one doctor who was airlifted in with him, and that was a Haitian doctor who went in as a translator, so they recognized that they had the translation need.
Mike, use the mic.
This wasn't because I'm very smart. It comes from practice. The health director of Istanbul has a team, it's called UMKE in Turkish, National Medical Rescue Team. What they do is they first bring in the communication technical engineers and build up their own communication network. They don't rely on what they find in the field. So at the health director, this seems to be common practice. Thank you.
I'll just give a brief response to the original question. I don't think that there's just one person who is needed. I think there's different people with different specialties that sometimes are needed. So for example, one of the first groups that we sent down were emergency surgeons that were helping in the hospitals with unfortunate amputations and whatnot. We also put people in UNICEF, Save the Children. They help coordinate agency actions. We had a water and sanitation specialist who was part of that response into different groups. I think there's a lot of people that did want to go that probably did not have a well-defined role, and that's part of the confusion of sort of internationally subsidized humanitarian responses. It gets quite crazy and whatnot. And then, of course, working with the government in Haiti was a slow, sort of tedious process. They were quite confused, and someone would make a decision and then somebody else wouldn't. So that progresses that way. So there's always the tension between working through a government system on the one hand and then the urgency of trying to save lives and help people on the other. And I'm not saying that went well in Haiti, but it did go. And if you look at Haiti today, it is better off today than it was pre-earthquake, frankly.
Merhaba. Benim Doktor Sibel Hanım'a bir sorum olacaktı. Öncelikle kendisine teşekkür etmek istiyorum. Ben de Türkiye'de tıp eğitimi almış biri olarak böyle interdisipliner bir yaklaşım benimsedikleri için göç ve sağlık konusunda. Ben kendisine şunu sormak istiyorum. Bu programı Marmara Üniversitesi'nde yaptıkları, yani bu ders sunum, bunu diğer üniversitelerle paylaşmayı ya da onların da böyle bir şey benimsemesi için herhangi bir çalışmanız var mı? Yani bunun daha fazla yaygınlaştırılması için.
Teşekkür ederim. Teşekkür ederim ama belki de daha iyi. Bekliyorum, tamam. Başka fakülteler var. Yani aslında küçük bir, buraya gelmeden önce bir sormuştum. Neredeyse %70'inde böyle bir program var. Belki çok daha iyidir, çok daha ilginçtir. Ama buraya gelip ben anlatma şansına sahip olduğum için bize en ilginç gelen bunu yapan ekip olarak hani öğrencilerin yaklaşımını görmek ilginçti. Ama Türkiye'nin birçok fakültesinde var. Yani iyi haber.
Third time, comment, questions? No. Okay, yes, here.
Is there any, tamam Türkçe soruyorum. Bu odada hiç, bu sınıfta hiç ya da işte neyse, burada hiç kimse var mı insani yardım alanında Türkiye'de artık bir enstitü kurmayı düşünen, planlayan, işte interdisipliner çalışmaya açık? Mesela Kolombiya Üniversitesi, mesela yani sorum herkese. Çünkü bu alanda ciddi bir ihtiyaç var. Yani 10 senedir bu alanda nacizane çalışmaya çalışıyorum. Hep uluslararası literatürden besleniyoruz Türkiye'de. 99'dan sonra böyle bir patlama olmuştu aslında. Hem insani yardım örgütleri hem de kalkınma örgütleri elini taşın altına koymuşlardı. Yeni örgütler de çıkmıştı. Ama bu mülteci krizinde bayağı hem insan kaynağı eksiğiyle çok karşı karşıyayız. alaylıyız yani aslında. Yani düşünürseniz aslında pek çok genç insanda var bu alanda çalışmak isteyen.
Ben cevap vermek istiyorum buna. Biz genellikle bir mesleğimiz var, işte hekimiz, hemşireyiz vesaire bir mesleğimiz var ve bunun mülteci sağlığıyla ilgilenmede bize yeterli becerileri verdiğini zannediyoruz. Aslında bu bir yanılgı. Çünkü aslında dediğiniz gibi birçok alandan bilgiyle beslenmeniz gerekiyor ve hiçbirimizin o kadar çok bilgisi yok. Ben epidemioloji yaptım, halk sağlığı yaptım, bir yere kadar yapabiliyorum. Sosyal bilimler vesaire diğer başka şeylerin de içinde olması lazım. Aslında bizim bunu tanıyor olmamız, farkında olmamız aslında çözümün yarısı diye düşünüyorum. Teşekkür ederim.
Okay, thank you very much for the sessions and for the panelists. And Rana, it's your turn.